and especially by these big media companies. Like, they look so desperate trying to get your clickbait clicks and trying to get you to read their clickbait articles. Holy cow, I'm going on a rant here. Breast cancer affects 1 in 8 women in their lifetime, and so that's pretty scary. And so when headlines are out there saying that some form of contraception might increase your risk of breast cancer, that definitely gets our attention. However, headlines can be very misleading, and that is the most frustrating thing that I think between myself and the other people within the profession out there, the medical providers, are frustrated with, is the headlines from these media companies scaring the people out there into reading their article. Welcome back. My name is Eric Schmidt. I'm a board-certified OBGYN, and we have a big update in women's health and some big news that's going across all the major news hubs that we need to straighten out here. Just recently, a study which was done in Denmark studied a bunch of Danish women and looking at hormonal IUD use, which is the levonorgestrel IUDs, which would be like Mirena or Kyleena or others, and the effect on whether or not they would have an increased risk of breast cancer. Let's go over the important parts of the study, and then we'll go over my take-home points and what we can learn from this. So when they looked at their two populations in this study, the ones that used levonorgestrel hormonal IUD and those that did not use any hormonal medications, they found that in the hormonal arm, there was an additional 14 cases or people that were diagnosed with breast cancer over that time. Take-home point number 1. Well, it is a shock to potentially hear that hormonal medication might cause an increased risk of breast cancer. It's not the first time we've actually heard this. We have heard this with other forms of hormonal medications, that it may have an association with breast cancer. And so there's a lot of compounding factors that go into this. Actually, from a statistics standpoint, this number is actually extremely low, and it really doesn't increase someone's risk significantly at all. Do I think this is a bad study? No. I think it's a good long-term study. However, when you're doing these studies, you can't possibly account for all of the potential compounding factors. You know, did someone that's seeking out an IUD because they're having bleeding problems because of other things such as smoking, obesity, excessive estrogen states, those are all different risk factors for breast cancer. And so, but those all things can cause potential bleeding irregularities. So someone might seek out an IUD. So, you know, there's a lot of things that go into this, and that's what really makes it the art and shared decision-making when you're talking with a patient to figure out if this is an acceptable potential risk to help with all those other issues and other things that an IUD can help with, especially the hormonal IUDs. Besides contraception, they have a number of benefits, and they can prevent a number of, the prevention of things like uterine cancer is significant with an IUD. It's actually the treatment for those early stages of hyperplasia or precancer of the uterine lining. And so while there may be potentially association or increased minutely at risk of breast cancer, like, yeah, it has a number of significant benefits too. And the important part too is this will continue to be investigated, because it's always important to challenge our previous thoughts and stances on certain things. There have actually been multiple studies done to try and see if there's an association with hormonal IUDs and breast cancer, and some have shown no increased risk. And so again, it's important to continue to challenge ourselves, our current thinking, and to try to better improve the overall health for you, for everyone, and the whole population. And so while this is just a small step in potentially challenging our thinking and counseling patients, I don't know that it's going to change the plan for or the recommendations for a lot of people going forward. So let's go over some potential common questions that someone may have in regards to IUDs now, knowing this information. So if you're thinking about getting an IUD, does this change your thought and your process? Well, you know, if someone is in need of contraception and they want reversible contraception, yes, someone could consider the non-hormonal IUD. It wouldn't have these same potential increased risks as the levonorgestrel or hormonal IUD. However, that IUD is not going to help with the bleeding and the dysmenorrhea or painful periods. The copper IUD has been shown to have some difficulty with removing. And so, you know, I would not let this factor into your idea, whether or not, if you want an IUD that's going to help with your bleeding and your cramping or your endometriosis, I would not let this information in this study sway you at this time. And the same goes for along the lines of take out the IUD. Now, if someone, let's say, by chance has a significant increase of breast cancer because they have a lot of other risk factors. Now, could you potentially make a choice for a different option? You could, or you could take it out. And first off, I want to say, like, this is a shared decision-making process. Like, you talk with your doctor, figure out the best plan for you, and go from there. Now, I personally, if I'm getting a lot of good relief from the hormonal IUD and I want to keep it, or I have a lot of those benefits, you weigh that against this potential new, not really that new information. And, that's, personally, I wouldn't. Or it was a, close family member, person I care about. Like, I would not let that factor into that decision, but everyone's different. And going back on those two prior scenarios too is like, there are actually lower hormonal dose IUDs. If someone isn't looking for exactly the bleeding or dysmenorrhea benefit, you could look into the Kylena IUD, lower hormonal dose, or the Skyla IUD, again, lower hormonal dose. Now, they don't really know the dose-dependent part of it as far as the studies and such, but if you wanted to reduce that risk further, I think the most frustrating part of all of this as a practitioner is IUDs get absolutely destroyed out there in social media. Almost every patient that comes to me says, oh, I've heard something bad about the IUD. And quite honestly, they work well for so many people. And it isn't the right answer for everyone. But this is just another potential clickbait type thing where it gets your attention because they say increased risk of breast cancer, the most common cancer in women in the United States, leading to the second most deaths in women in the United States. Hell yeah, that's scary. But looking at how much statistically this changes things and talking with your doctor about all the potential other benefits that an IUD might have, such as decreasing uterine cancer, improvement in bleeding. It could take your bleeding completely away. And that if someone bleeds for 5 days every month, 5 times 12 is 60. Yes. So that's 60 less days of having to worry about a menstrual cycle. And so I think it's frustrating out there seeing that IUDs continue to get destroyed out in and especially by these big media companies. Like, they look so desperate trying to get your clickbait clicks and trying to get you to read their clickbait articles. Holy cow, I'm going on a rant here. Shame on some of them for the way they phrase those articles. Now, they do try to, in the smaller sections, say like, okay, experts say it's minimal change and such, but yeah, I'm glad I didn't make this video yesterday. I was pretty frustrated. But anyway, it's a conversation between you and your doctor. And so if that number scares you, you potentially have other options. So this is another episode in updates in women's healthcare. Stay tuned for the next one.